time horizons. You know, we know a lot of funding is 1 year or 6 months, and a lot of our monitoring was around that time horizon. It was often very, the monitoring was often very sector-based. And so we were monitoring project-level outcomes without really looking at what the overall goals of refugee families might be around well-being, around resilience, about making sure that they had a path towards resilience. And also, when we did see that the tools that were there for self-reliance, we noticed that a lot of those tools were very long, hundreds of questions, and often very complicated. And so we developed this tool to help us understand what assistance people needed, to also identify when they no longer needed assistance, and so that the limited resources could be allocated elsewhere, and also to help us to understand where there were gaps in services, so that host governments, development and humanitarian actions could respond to those needs. So that was really the background of why we developed this tool as practitioners. So the tool's aim was to really capture at a household level increases in resilience, the collective impact of all of our efforts and of aid efforts, and also to have an easy-to-use collection tool, something that would be easy for practitioners to use. So that was the aim of the tool based on all of the things that we had identified in the refugee landscape. So in terms of the foundations and the fundamentals of the tool and what was the underpinning for the tool development was, as we noted, we really wanted to focus on resilience, really looking at the assets of refugees, the power of refugees as a starting place. And also with the idea that we would use case management as the project that would help us to understand what was happening with the refugees. So that case managers would have an overall view of what the household needs were, and then they would be able to link to available resources. And we expected that this tool would fit into that case management model. So now I'll hand over to Dale.
Great, thanks, Kelly. So as Kelly mentioned in the foundational elements of the tool, this is really focused on how we measure changes in well-being or resilience over time. And so we decided we needed a definition for what we were talking about. So we used this definition, which is commonly adhered to throughout our communities, which is the ability of people, households, communities, countries, and systems to mitigate, adapt to, and recover from shocks and stresses in a manner that reduces chronic vulnerability and facilitates inclusive growth. And of course, for the populations of concern to all of us, refugees, those who are forcibly displaced, have dealt with shocks and stresses, leaving them vulnerable. So what we need to think about is how do we collectively facilitate this inclusive growth. As Kelly also mentioned, part of our underpinning of this program was to look at an asset model. And for those of you who do our livelihoods practitioners, this will be familiar to you. It's not a program activity, but it's really a conceptual approach. Within those of us who look at livelihoods, we recognize that there are basically 5 categories of assets that we all need as human beings to reduce our vulnerability and to create and expand opportunities for us. And some of you will be familiar with this, some of you may not, but those 5 assets are basically human capital, and that includes our education, our health, the skills and experience we come with, our ability to work, natural capital, which may not be as relevant for urban populations, but for more rural or non-camp-based populations, this would be access to land, water, etc. Financial capital, which is income, wages, salaries, savings, remittances, those kinds of things. Social capital is your extended family, your friends, your networks, your community groups, those kinds of things, those places where we all go in times of emergencies, those places where we all go when we need help. And then physical capital, which is shelter, utilities, roads, cell phones, those kinds of things that allow us to make our lives work, basically. And we believe that all of us need a good balance of these things to actually be resilient and to be less vulnerable. And so this was some of the foundational elements we thought about in developing this index. So what we did is we first went to Beirut back in October of 2014 and basically presented that definition of resilience. We talked to them about this asset model and did it make sense to them. And then from there, we asked them to think about, okay, what would you want to know? What would you want to measure to understand how well your refugee households are doing? And at that workshop, we had a number of UN agencies, including UNHCR staff. We had UNRWA staff. We had a number of international NGOs. We had national NGOs who were doing case management on behalf of UNHCR. We also had the Ministry of Social Welfare from the government of Lebanon. We did other in-country consultations, including with refugees themselves. What are your priority service needs? Do you have access to those? What would it look like for you to be doing well in this context? We did a literature review to look at all of the different tools that are out there that people are already using to see what we could learn from those. And then we drafted the tool. We sent it around widely, as you see on the expert input, to numerous colleagues to say, does this make any sense? Do you have feedback? And we got a lot of feedback. So we refined the tool. We finalized that in Beirut with case managers and then started testing it in Lebanon in February of last year. That testing is still going on in Lebanon, and we've expanded the pilot to both Egypt and Ecuador this year, where they are currently rolling it out. So in terms of the implementation, the nuts and the bolts of the implementation, we are working with 7 different operational partners. You see them on your screen. All of these organizations are providing a level of case management services to Syrian refugees in the case of Lebanon, to a myriad of different refugee groups in Egypt, and to primarily Colombian refugees in Ecuador. So they're all using the tool, and we're trying to learn from them how effective it is in their work and their services. The tool is actually, we use a free application, electronic application, that's called ODK Collect, and all of the data is collected on tablets, and we also partner with ONA, who is our platform host and our IT support for the project. So as soon as these forms are completed electronically on tablets, they are allowed to be uploaded to this platform hosted by ONA, where we can all see the data in real time, and we can generate reports looking at changes over time, looking at how does income correlate to kids in school, that kind of thing. And so here on the screen, you now see what that looks like on a phone or a tablet. So I'll turn it back over to Kellie to actually walk us through quickly the tool itself.
So thanks, Dale. As Dale described, we took part in this whole process to really understand what it is that we should be collecting from all of these different consultations and understand what were the key issues that we needed to find out about for refugees. So the tool now has 12 different topic areas that we identified that we needed to understand how the well-being and the self-reliance of refugees and how they're doing. We know that there are hundreds of questions that we could ask about, but we felt from the review that we did and the input that we received that these 12 issues are the most important information to determine how refugees are doing and how they're doing on a path towards self-reliance or resilience. So the questions that we're asking are quantitative. They're all on a scale of 1 to 5. We find that they're simple. Like I said, they're just 12 different things. And we find that they give us a picture of, on a consistent basis of what's going on. So these questions are asked of the head of the household, but on behalf of the rest of the household. So if in a household there are people, there's only one person working who might be, a son, the head of household will say that there's somebody working in that household. So it is on behalf of an entire household. We're not asking individuals to respond on behalf of themselves. So I'll go through these 12 different elements so that you can get a sense of what types of things we're trying to collect and what those the five scales look like. So you can see for income here, we're looking at income and savings. And we start at the lowest, it would be the worst kind of scenario, and go up to the most ideal situation for a refugee family. As I noticed, it's quantitative information that we're collecting, but we recognize there might be some nuanced issues that might not be able to be captured in these 5 options being provided. So there is a note section with qualitative data. And we do want people to score the family at the highest level possible so that we get a good sense of where people are, how people are doing. So that the income, you can see that. We'll move on now to employment. You can see employment captures some different information, looking at, a scenario where maybe nobody in the household has a job, to that there's some full-time employment happening and people are able to save some of their earnings. The next question is around shelter, and you can see in terms of the shelter question that there's some nuance there. There are a lot of ors available because we recognize that for this to be a tool that's used from Lebanon to Egypt to Ecuador, all of them have different scenarios and different type of housing options available to people. That in some places an unfinished building, like in Lebanon, is a very common issue, that there are unfinished buildings, but in other places that might not be the language that people use. So that's why we're saying an inappropriate structure for the purpose of shelter. So trying to make sure that these reflect the different realities that might come up around the world. The next one is around utilities. This is the only one that's not a 1 to 5 scale. People are supposed to check all that apply, and you can see, in the heat, ventilation. So in Lebanon, heating was the problem. In Ecuador, ventilation was the problem, making sure people have a fan or some ability to cool themselves in the hot weather. So that's just check all that apply. The food issue, this is subjective. This is not a nutrition survey. We're not going out. We're not measuring what's in a food basket. This is asking families for themselves, how do they feel that they're doing? And you can see that we're recognizing that a lot of families receive food vouchers or aid to meet their nutritional needs. And it's looking at, 2 meals a day, 3 meals a day, and getting people's refugees themselves to tell us how they think they're doing from their food situation. And the next is healthcare, and the healthcare we're looking at first accessibility. Is healthcare even available to them? And also, is it can they afford it? So looking at those 2 issues, and then also looking at primary versus specialized care, and is that available for families? Transportation and mobility, this was one that I would say, like from the beginning, this was not something that Dal and I had on our radar, but this very much came out through the review and getting input from the refugees themselves about what's important to them, and once again, looking at what transportation is available, recognizing that people might need to seek health care, they might need to be able to get to their job, and the importance of having transport available so that they can get the services they need and also pursue livelihoods opportunities as well. Education, this one you can see is a little bit tricky, and we really struggled putting this one together, recognizing that in some places, culturally it might not be as acceptable for girls to be in school, so maybe they might be held back from school, or recognizing that in some places it might be the girls in school because the boys are sent out to work. So we really wanted to make sure that this captured, if there was one gender was not available or not able to go to school and to be able to better understand why that was. But obviously we want the best to be number 5, that all children, boys and girls, are able to access both primary and secondary school. And so that's what that question captures. The next question is around community involvement, and this topic really is trying to get at that issue that Dale pointed out early in the asset model, maybe to really make sure that we're capturing social capital building and how households are doing in terms of social capital. Are they involved in their community, and also trying to look at what the involvement looks like. Is it, with others in the refugee community? Is there also some interaction with the host community? And so that's really trying to look at, are they able to build that asset, and at what stage they are. Safety, this was an issue that really came out very strongly in Lebanon as an issue, and we wanted to make sure that this was captured. And so, once again, it's subjective, getting a sense of how people feel about their own safety, and also recognizing that there might be differences for men and for women. And then are people actually restricting the movements? Because I think this can tell us also something, once again, about how much people are able to pursue livelihood opportunities, school opportunities, and that sort of thing, and seeking services in general. The next question is around documentation, and once again, given that we want this to be, able for a global audience, once again from Lebanon to Ecuador, that's one that we definitely had to tweak after being in Ecuador and looking at the different types of documentation that might be available to people, with government that's in some countries in charge of registration and in charge of the documentation. So this one tries to recognize the different possibilities in different countries in terms of what our focus for this one is really just to make sure that people are legal in the country that where they're staying. And then this is one that we really just wanted to get a sense from refugees themselves. How are they feeling about their situation? Are they feeling like their situation is getting better? Do they look with optimism to their future? And we really feel like this is an important one for refugees to be able to express themselves, and also to get a pulse on the situation. So that's just an overview of the questions. I know I went through them quickly, but we wanted to just give you a feel of what that 1 to 5 scale looked like and the types of information we're trying to collect to understand how refugees are doing.
So you got a sense from Kellie about the tool, and as we mentioned in the beginning, it's very simple. We really try to distill down and focus on those few things that give us most of the story about what we need to know in terms of how well refugees are doing. Of course, we always want to know hundreds of things, but it was really what are the few things that give us most of the picture. So that was the focus. So in phase 1, we started again rolling this out in Lebanon with 3 local NGOs, and they are tracking 330 Syrian households, and they're going to be doing that over an 18-month period. They've done midline, or baseline, and the first midline already, which I'll go through in a minute. And then we started rolling it out in Egypt and Ecuador this year with those 4 additional partners. In Ecuador and Egypt, they're each tracking 250 households, so an additional 500 in total. So about 830 households overall. And again, the idea is not to look at are these refugees different than the refugees that are not being tracked, but the idea, the learning we're after is this tool useful in helping to capture the collective impact of our work, of the services provided by host government, et cetera, so that we can really see if refugees their vulnerability is reducing over time and their resilience or well-being increasing. So I'll just go through a couple of slides, about 4 slides, that show you a little bit of data on the kinds of things that come out on baseline and midline. So this is from one of our partners in Lebanon on the households that they were tracking. And what you see, baseline is the blue, midline 6 months later is the red, and what you see is you know, more than a 10% increase in the number of households that have no income and no savings. So if you're working with them, obviously that's going to raise some red flags. That's going to be a concern. And then you also have, though, some decreases at the upper end where households can meet their needs with subsidies. So again, it shows you that actually in many ways these households are doing less well over time, right? And those are important things for us to capture because it also gives these case management agencies things to think about and things to focus on. Unemployment, and this is, again, baseline and midline from another of the partners, what you see here is that there's a very slight decrease in the percentage that have no job, but here you see a decrease in those who have temporary, irregular, or seasonal jobs, and slight increases, so this is a positive trend with this organization, slight increases in those who have regular part-time employment or full-time employment. And again, some of that may be a reflection of where this organization works and who their caseload is. On the next slide, you see education. And here, from baseline to midline, you see some fairly significant increases at the top end of the scale, where either all primary school children are attending school or all primary and secondary school children are attending school. So that's a positive trend, but at the same time, you see fully 50% of households have no eligible children attending school. So again, if you're doing case management work with these households, you're going to be looking at how do I do those referrals to the school system? How do I facilitate their access to school? What are the barriers? What are the challenges? How do we address that and work on that? And then the last example I will give you is on the well-being indicator that Kellie just talked about. And I pulled this one out because I think it's really quite troubling in that you see a complete drop-off at the upper end of the scale, and you see a very substantive increase at the bottom of the scale of more than 20%, a 20% increase of refugees who feel absolutely hopeless about the future. And obviously, all of these things need to be contextualized. There's reasons for this. It can be that their savings have dried up, that there's been cuts in humanitarian aid, that we're entering year 5 of the Syrian conflict, so they see that opportunities to go home are perhaps less and less realistic over time. So what are we learning? We did ask the case managers who are doing this implementation, is this helpful? Is it helpful to you? And they've come back and they said, you know, it's really good for us. It's really simple to use, but it helps us actually focus and prioritize what we should work on first. If the kids aren't in school, if neither mom or dad has a job, if the shelter is completely inadequate, it really helps us focus and prioritize what we should be working on and liaising with and the kind of referrals we should be making. And they also said they feel like it helps them better understand their clients. Some of the agencies, for example, have historically focused on child protection, and so they might have been looking at the child in the household and is the child in school and does the child need psychosocial support, but not actually contextualizing that to say, well, the child's not in school because nobody has any income in the household, there's no access to transportation, et cetera. And they've told us that they feel like the refugees feel like they're being heard, that they feel like they can give responses to all of these, and that these case managers actually understand better this entire household. It also provides, they said, it's helpful to provide big picture information. It highlights service gaps. So if you're working in the Bekaa Valley and people don't have access to health care, it highlights those kinds of things. It also can highlight barriers to access. If the kids aren't in school, obviously you're going to probe and ask, why are they not in school? So the tool is now available in English, Spanish, and Arabic. What we found, even though Kellie mentioned the tweaks we did on there to roll it out in these other contexts, what we found is that they largely work across these three very different contexts with very different refugee populations. You know, in Cairo, you're not going to have anybody living in a tent, for example, at the low end of the shelter indicator, but the other ones are still relevant. We continue to learn. We're still looking at other tools. We're sharing what we're learning and certainly thinking about what the next steps might be. So one of the things, just to very quickly talk about some comparison with other tools, we looked, for example, at the vulnerability assessment framework in Jordan and the vulnerability assessment of Syrian refugees in Lebanon and said, how do these compare to what we're trying to do and what they're learning? Obviously, the starting point for the other two is quite different. It's really looking at targeting for the first one in Jordan. You know, how do we target the most vulnerable? How to identify who is the most vulnerable? The Lebanon example is more looking at the vulnerability of the caseload writ large by getting somewhat of a representational sample. And we're trying to look at how do we capture resilience or well-being, and how do we actually perhaps even learn when do refugees no longer need assistance. The time frames are very similar. We all do this kind of, well, at Lebanon it's annually, otherwise it's every 6 months. But what we found is quite different is actually the numbers of indicators used and the complexity of the indicators used, which you can see a little bit there on the chart that's available to you. So some of them use many, many more indicators, or, you know, atomic indicators, subsets of indicators. But in fact, when you look at the kinds of things being measured, we're actually measuring quite similar things, which we think is actually quite interesting. So where do we go from here? And this is where we will stop and open it up to you. We've been sharing learning. There are other people doing some very interesting things. Refuge Point is piloting a self-reliance tool in Nairobi. UNHCR is looking at an integration index in Ecuador. Obviously, we have these vulnerability assessment tools that are out there. What we think we need to do as a community is come up with a common tool. And we're certainly, Kellie and I are not saying this is the right tool. We think there's value in people piloting different things, but we think there's also a responsibility for us to eventually come together and say, what can we agree to use so that we can really capture the collective impact of all of our work and the host government services, the work of development actors, et cetera, that allow us to better target those who really need the assistance, because we know resources are very stretched and needs expand far faster than we can meet them. That will help us understand when households no longer need assistance, so we can rechannel that assistance to those who need it. That help us understand how we identify service gaps that humanitarian development and host government actors can address. And we believe we can only do these things if we move away from merely capturing individual pilot impact and emphasize capturing our collective impact on the well-being of refugee households. So that's what we've been trying to do, and we would love to open it up to questions to you all now. Thank you.
Thank you very much, Dale and Kellie. So the floor is now open for questions. I received a few questions in the chat box, but if you would like to talk to us, please use the hand icon and I will unmute you. Dale, I have the first question for you in the chat box.
Yep. That's a really important question, Kizu. I think, you know, we rely on the case managers, and they're actually doing.
Sorry to interrupt you. Could you please read the questions, because
I'm sorry. The question is, if the head of household is being asked, do you have access to the well-being from household members like children, women, etc., whose views might be silenced, excluded if they are not the head of the household? And I think that's a really critical and important point. As I mentioned, we are working with case management agencies, and they're actually using this tool at intake. But obviously at intake, they're getting the entire case history, right? So they're looking at the entire family. They're often going out and doing a household visit, and so they're trying to understand all of the needs within the family and even get the visual picture of what that looks like. But I think, so we rely on them and their rapport that they develop with these refugee households to actually get at some of this information. But I think, yeah, it's not perfect for sure.
Thank you. Next question coming to your chat box.
This question is, why choose to focus on household level instead of personal level? Well-being may be completely different for different people in the household. Does this not create a distorted image, taking into account, for example, gender, age, disability, etc.?
Yes, I think that's once again a really good question, and we don't think that this is perfect. But I mean, when we do look at how families are faring and households are faring, we do notice that people interact as a group. And so they pool their resources, and it's not, that people often aren't acting as individuals. And so that's why we wanted to look at this from a household level, so that we can see how people are interacting with each other to help each other, so that the entire family is moving towards self-reliance.
And if I could add, I mean, again, excellent question. You know, one single tool cannot do all things, and we certainly didn't get everything right, but we do believe that so often in our programs we target individuals, we target the child, we target the mother, we might target the head of household for a cash transfer, but we don't actually look at, but how does that actually serve the entire household? So if dad is getting a cash transfer, is the child more likely to be in school? And if that child is not more likely to be in school, then what are we learning from that? Yeah. And what other kinds of interventions are needed? So we feel like we've been better as a community capturing that individual level impact, but that we haven't been very good at looking at the roll-on effects within a household. When you target one member, if you get the children in school, what are the implications for mom? Is mom now able to go to work, for example? That we don't actually look at the picture that way very often, but a really important point. Okay, the next question says, related to the questionnaire that is directed to the head of household, that in case of Syrian refugees is predominantly male, how do we ensure to get an accurate replies and the gendered perspective?
Yeah, once again, a really good question, and we don't think that this captures all of it. But as Dal said, we don't expect that case managers are going to use this tool only. We expect that this is going to be a complement. Case managers, we expect, will be going out to seeing the households themselves. We expect that they will be interacting with the family to make sure that there are specific referrals for the different needs within the household. So we do expect that this will be a complement to other things that are happening within that case management service and referral process.
And again, what we're hoping, and that as we do more data analysis, as more of the information comes in for us, we're hoping to be able to look at things like, if a member of the household is employed and has a decent enough income, does that mean the people in the household are eating 3 meals a day? Does it mean the female head of the household, or the mother, the wife of the household, is accessing health care? Does it mean the kids are in school? So again, it's an imperfect tool to look at all of those gendered impacts, but we hope by correlating these different indicators, we can say, if this thing happens, these things happen for other members of the household.
But thank you for that question. It's something that we do need to be thinking about.
The next question says, it's a pity that you didn't consider also assessing the availability of drinking water and wastewater and solid waste management services, as these are vital ones and would affect the capacity of refugees to adapt themselves to the local context.
Yeah, just as noted, we from the review that we did, we felt that the different topics that we targeted are the most critical to getting a good picture about where people are. Under the utilities, we do know whether people have a toilet or running water, but we didn't explore that further, it's true. And maybe in terms of with the greater community and some of the other tools, maybe if we see that that's something that needs a stronger emphasis, that's something that we could learn from that. But from the initial review that we did, we felt that where we put it in utilities captured enough of the information. But it's an interesting conversation to further explore.
Yes, and I would just add, you know, these utilities that we actually look at in using the tool, these were the ones that the case managers themselves said mattered. And so we were relying on them in all three of these local contexts about what is it that makes a household more livable and the situation they're in. But we, again, as Kellie mentioned at the very beginning of the presentation, each one of these also has a note section. And we actually give some guidance on the tool itself of the kinds of things people will want to put in the notes section so that they should capture if there's concerns about the safety of that water, for example, those kinds of things, or the things they should be capturing in the qualitative data that complements this. The next question says, these are interesting findings, but in the case of Lebanon, it is not clear that in the aggregate this provides us with more or better information than the vulnerability assessment for Syrian refugees or the household profiling questionnaire, which determines socioeconomic vulnerability at the household. At the household level, does the result of the well-being tool provide a different result than the proxy means test for socioeconomic vulnerability? Has this been compared for the same households? I think, I mean, we haven't compared for the same households. I think the big difference, obviously, as I mentioned, they're getting at some of the same information. They're telling us some of the same story. I think the big difference with the vulnerability assessment for Syrian refugees in Lebanon is, as I understand it, and correct me if I'm wrong, but as I understand it, it is looking kind of at a sample of the entire caseload to see how the caseload is doing and does that change over time, which is critical information, I think, for the humanitarian and donors to the humanitarian sector writ large. What we were trying to do, again, is come up with something really simple that's easily replicable globally, potentially, that gives us enough of the story to see our refugees doing better at the household level from one point in time to another point in time. And is there even perhaps a point in time where they don't need our assistance services, but maybe just the protection? So our focus was on simplicity, easily replicable, and replicable across different geographic and population sites. Attila, we're waiting to see if there are additional questions.
Hi, Dale. There are about 35 questions in the queue, so I just put the next one in your chat box.
Okay, great. Thanks. So thanks for being patient, everybody. We're just waiting for them to appear. Here we go. This question is, would the tool be able to fulfill a similar objective of being able to target households that are no longer in need of case management assistance and or targeted for cash, food or cash in Lebanon and Jordan? Yes, we think so. It's a good question. I think ideally what we would hope, and understanding that Lebanon and Jordan are particularly difficult contexts because of right-to-work issues, But Ecuador obviously is very different in that regard. But if we can say that people are at the highest end of the income, have regular income with enough to save and regular full-time employment on the employment index, and because of that their shelter's appropriate and their kids are in school and they're accessing health care, then they probably don't need our assistance anymore. Not in the same way that others who are in a much more vulnerable situation might. And so if we're doing cash transfers, food vouchers, those kinds of things, ideally it should allow us to redirect those to those who need it most.
And also to add, one thing that we've discussed but haven't come up with any solutions for is that would it be possible to have kind of a self-report situation for refugees, so that if they're no longer engaging with the case managers because they don't feel that they need that as often, is there some way that that they would be able to just self-report on their situation? What would be their incentive to even do that? Those are some of the things we're thinking about, right? So that over a long term, we would be able to find out how these families are doing in terms of their move towards self-reliance.
And the next question is, for the piloting, how are you documenting the response case management agencies are having when they analyze this data? That is, what follow-up actions are they taking to trends, et cetera? And is there kind of any kind of interagency consultation in this process? I think that's exactly where we're trying to go next. And that is, obviously we've been getting feedback from the case managers. We have Skype calls with all of the partners in the process about every 6 weeks, just to see how effective is it? How is it helpful to you? What does it mean for you and your staff? What are you learning? And so, as I mentioned in an earlier slide about some of the feedback and some of the learning that's coming out, they do tell us that, yes, it is helping them prioritize referrals. It's actually helping them understand the entire household better, the refugees feel better listened to. But clearly, as we move on to the next stages of data collection, in Ecuador and Egypt, they're just doing their baseline data collection now. In Lebanon, they did baseline last year. They just completed the first round of midline, and they're now, they completed the first round of midline in September. They're completing the second round of midline data now. So more and more of the picture is emerging. And so what we want to be able to do is to say, okay, as the picture unfolds over time, what are we learning collectively? What does it mean for our respective jobs? What does it mean for our partners? If there are cuts in services and we're seeing increases, for example, in vulnerability, like we saw in some of those slides in Lebanon, what does that mean in our engagement with donors, with other actors on the ground, et cetera? I hope I answered that question. It's a good one.
There is a hand raised. Sonia would like to comment, so Sonia.
Yeah, hi. This is not Sonia, this is Peter from Ecuador, but we're talking to you from Quito, Ecuador, and Sonia's part of the team here. I just wanted to very quickly mention, Dale, thanks for the presentation. You mentioned the local integration index that Ecuador has been working on, and which in fact we've been sharing also with quite a few colleagues already in headquarters. And we also see that as a tool that could be replicated elsewhere. Basically, it measures the degree of local integration across the legal, the social, and the socio-economic and the cultural aspects of lives of refugees. This has been based on a baseline data gathering of over 9,000 refugees, and we are working on that right now. I would like to quickly pass the floor to Santiago, who is our colleague who has been directly involved in this. And to briefly explain how it works, and then maybe if there's interest, we could organize another webinar because it's quite detailed and in its explanation. But I would just simply quickly want to pass the floor to Santiago to say a few words. Thanks.
Yes, Santiago. We have information in our baseline data that it's for over 3,000 households that represent more than 9,000 people. So we have information for different dimensions. So we have the legal dimension that considers documentation. We have social dimensions that considers access to health, access to education, housing, relationship in the community, etc. And we have the economic dimension that considers employment and income. With all this information, we were able to create the local integration index that we hope it measures the level of integration that each household has in the Ecuadorian community. And this is a tool that we are using as a targeting tool for our programs in Ecuador, and we will be able to measure the impact of our programs through this tool.
Great, thanks. Yeah. Well, when we were in Ecuador, we met with some of your colleagues, and we heard about the integration index, and it sounds fantastic, and it would be great to do some shared learning, to learn more about your index based on the development since that time, and also see how to learn from what you're doing with what we're doing with what some of the other partners are doing as well.
Absolutely. I mean, it's a very exciting initiative, and I think, I mean, from where I sit at least, I think there's a really critical time for us to be piloting these various tools because that's how we learn as a community. But then at some point, we need to come together and say, okay, let's come up with a common tool that we will all agree to use, whoever it is. And, you know, we don't have any vested interest in ours. But I think the critical point is we need to start looking at collective impacts over time on the well-being of refugee households, and whether that's getting to self-reliance, which you can do in some places, whether that's getting to full integration, including legal, cultural, social integration, which you can do in some contexts but not others. So what does that look like? What kind of tool might that be? So thanks for sharing that.
Okay.
Dale, you see the next question?
Yeah, we see it. Okay. Popped up. Thanks.
So the next question is focused on the use of qualitative versus quantitative information and how we integrate the qualitative information into the data analysis. I mean, right now we're using the quantitative information for a lot of the analysis, but then when we are seeing that there's some trends that are a little bit confusing, we pull into that qualitative data, but we also expect that the case managers themselves will be using that qualitative data to be able to focus their referrals more appropriately as well.
Exactly. A lot of the qualitative data is stuff that the case managers use. So they're saying, you know, they're finding out actually the girls in this household are in school, but the boys are working. And so that kind of helps them decide what to prioritize and focus on. So it is used by them, but we do, as Kelly mentioned, when we're seeing trends that don't make a lot of sense or they're going in the wrong direction, we start looking at that qualitative data to see what else we're learning there. The next question says that the UNHCR survey released today, the top research for refugee exodus to Europe was inability to work and exploitation related to work in the informal sector, that 41% of all arrivals cited this as the top reason for onward migration. Thus, the importance of capturing information about whether work engagement of a refugee household are in the formal or informal sector and how many minors are engaged in the work due to fear of adults being caught working illegally. Again, really good point. We had lots of discussions around this point with the organizations doing the data collection, but in many places, obviously, right to work is critical, and when there's no right to work, you know, the full integration is never going to be possible. But obviously, in many contexts, there is no right to work, and so we need to think about how do we exploit the opportunities in the informal sector in a way that are as safe and as dignified as possible, and what are the safest opportunities that may be out there for refugees. You know, I think we did talk about, do we have to capture whether the work is in the informal market or the formal market, and I think with the case managers, we kind of came to the conclusion that, you know, as long as people feel safe and they're making money and are able to save and have full-time work, maybe that's as much as we need to know, recognizing that in many of these countries, even the host community folks are primarily working in the informal sector. And so it's so common, and so it's less about what sector they're working in, but more about, are they making a dignified income and are they safe doing the work? We're going to back up a little bit. There was another question that came in. This question is, thanks for the presentation and tool. It's great. The other questions seem to be circling around this, but I'll go ahead and ask it directly. Protection. Refugee assistance is about the protection and assistance for refugees. Where do you see this tool connecting with others to make sure that this aspect is highlighted? Thanks. Really good question. Again, we tried to capture that in that question on safety. We tried to make it...
And documentation.
And documentation. So obviously if you have the full legal right to remain in the country, there are various protections that come with that. If you don't have that, obviously you have some concerns. But then on the safety question, recognizing that households are not going to understand protection as we might all understand it, we really tried to break it down in a way that made sense to them. Are you discriminated against? Are you harassed? Boom, boom, boom. And then obviously with all of the services, education, health, you're getting at that access to basic services, which also are part of that protection environment. So there may be better ways to do this, but I think that's kind of where we landed at the moment.
And I think also to add, a lot of the organizations that we're working with in terms of case management, protection is their key focus in terms of their entry point in terms of case management is very much from a protection perspective. And so I think that was the other way that this tool interacts with that, is recognizing that the case managers are looking at that. So in terms of how it connects with other tools, I wouldn't say it's direct. We're not making any reference to that directly, besides what Dale said, but just recognizing that the case managers have that front and center of their mind, and a lot of their referrals are protection referrals.
And because of time, and we've been going for an hour, we'll conclude with this one last question that at least I see on my screen, which is, how are the experiences with respect to the completeness and truthfulness of the information? Are refugees hesitant to answer certain questions, for example, with respect to right to work or documentation if there are government restrictions, for example? Again, really good point. I think, and this is why part of our model is case management model. We wanted, rather than just random enumerators going out doing data collection, we wanted people doing the data collection who are already working with or beginning to work with these households and have some level of rapport with the households. And actually they're primarily doing home visits, so they're actually getting at a lot of the information. And I think the feedback from them thus far is it resonates with the other information they're getting from the refugee households. Again, this is only part of the information they're getting when they do that intake, which includes a much more extensive case history, concerns, all of the kinds of things that a case manager would normally do. The idea here is, can you quickly capture the highlighted needs, and which helps prioritize your work, the referrals needed, et cetera, and then capture the impact of doing that work over time.
And also, that was an issue that came up quite strongly in our workshop in terms of concerns from the case managers around especially the income and employment issue. There was concerns that there would be some sensitivity around that, but thus far they haven't really seen that, and instead have felt that asking these questions have helped them to understand the situation of the refugee families better, and also have helped refugees to be able to express what their concerns are better. So that was an issue that came up, but so far we haven't seen it playing itself out.
But thank you all so much for participating and listening in.
And for the wonderful questions as well. Thank you.
Excellent questions. Obviously, we're all learning. We don't have it right, but we hope that this contributes to broader learning, as many of the other initiatives are. And you heard about the one in Ecuador. And I think as a community, this is the direction we just need to move in.
Yeah.
And Attila, I'll hand it back over to you.
Yes, thank you, everyone.
Thank you so much, Kellie and Dale, for the very engaging presentation. And sorry, everyone, if your question was not answered, but I think the topic is very hot, as we can see from the interaction. The presentation, the recording of this webinar will be posted in a few days at the Urban Task Team website, which is urbangoodpractices.org. So please check that out. And keep an eye for webinars, for upcoming webinars, because there will be more sessions organized during the year. Thank you so much, and have a great day. Bye-bye.
Thank you all.
Thank you.
Bye.